In this video, I will be talking about discrete trial teaching, DTT, also known as discrete trial instruction, DTI. In the 1980s, Dr. Ivar Lavas created discrete trial teaching as a learning technique used when working with children with autism. This method of learning teaches learners skills that can be broken down one step at a time. DTT takes place in a highly structured environment where a behavior technician works one-on-one with a learner in a minimally distracting environment. DTT is the most common and most effective type of therapy used to treat autism spectrum disorder. In DTT, providing consistent repetition is important because it gives learners a lot of practice when working to master a skill. All skills are taught until mastery. Before beginning, you will need to review the child's individualized written skill acquisition plan. This can be found in the child's current program binder. This plan provides goals and procedures necessary to teach skills associated with each goal. Doing a preference assessment before starting your DTT session will help you determine what the highest reinforcers will be for that child. Building momentum will also help the child be more successful and compliant during your session. There is a three-term contingency in ABA: antecedent, behavior, consequence, or ABC. In DTT, the contingency looks like this. A is an SD, which is a direction given verbally or non-verbally. When speaking verbally, use a clear and slightly louder tone of voice than usual. B is the child's response, which is anything following the SD. That could be correct, incorrect, prompted, or no response at all. C is the reinforcement. This is anything that the child is willing to work for or change behavior for. This also increases a behavior in the future. An example of this is a behavior technician stating the SD, "Give me blue." The child's response will be to hand the blue card to the behavior technician. The behavior technician will then reinforce the child with a preferred toy, an edible, or social praise. If the child responds incorrectly, the behavior technician will prompt the correct response. Prompting procedures can be used in DTT, but are client and program specific. Varying materials used during programs will help the learner generalize skills, but this will be at the instruction of the senior therapist.